Hi, I'm Dakota Shola, and I am presenting today's presentation. I'm a Master's of Arts Counseling Psychology student at Yorkville University. Today, I will be exploring emotion and social cognition, understanding anxiety and social anxiety disorder. I want to thank you for joining me today, and I hope that you learned something from my presentation. So, what exactly is anxiety? Well, anxiety is the chronic fear that persists in the absence of any direct threat. It is a common psychological correlate with stress. Often, it goes hand in hand with stress. But there are four types of anxiety: generalized anxiety disorder, known as GAD, specific phobias, agoraphobia, and panic disorder. Next, I would like to explore the four types of anxiety disorders to get a better understanding of what anxiety is and how it might present itself. The first one I would like to explore is generalized anxiety disorder, also known as GAD. GAD is often a response to stress, and a great deal of anxiety and worry is felt. This worry or anxiety can be brought on by a wide variety of activities or situations. There is an apparent close association between GAD and major depression. Many treatments may be similar to those treating other emotional disorders. There is known to be a decrease in real functioning with a person's social life and a decrease in life satisfaction. Therefore, GAD really impacts somebody's life. It may be beneficial to explore with clients the nature of worry and the function of the worry. Now, I would like to explore specific phobias. Specific phobias are an intense fear of anxiety about particular objects or situations. Often a person with a phobia will try hard to avoid that object or the situation and will take extreme measures to do so. An example of objects or situations producing some anxiety are birds, spiders, enclosed spaces, and the dark. Specific phobias are also the most treatable of the anxiety disorders. The third anxiety disorder that I would like to discuss is agoraphobia. Agoraphobia is a fear of public places and open spaces. Though this may be confused with specific phobias, it is often more incapacitating and therefore it has been given its own diagnostic category. As a result of anxiety concerning panic-like sensations, the individual with agoraphobia may avoid travel outside the home or may require a companion when away from the home. This shows isolation within agoraphobia. The age of onset of agoraphobia is 24 years old. The final type of anxiety disorder that I would like to discuss here today is panic disorder. Now, panic disorder is characterized by the recurrent rapid onset of attacks and of extreme fear and severe symptoms of stress. Some examples might be choking, heart palpitations, and shortness of breath. Panic attacks do occur in some cases in the other three anxiety disorders as well, and that's something to keep in mind when assessing and planning treatment for somebody who may have an anxiety disorder. Panic disorder is one of the most studied anxiety disorders, and the most common and effective treatment is cognitive behavioral therapy, also known as CBT. And some drug treatments can be very helpful as well, especially in combination of CBT or therapy. I have compiled a list of the feelings people may experience during a panicked episode, also known as a panic attack. These feelings include shortness of breath, heart palpitations, dizziness, trembling or shaking, the feeling of choking, sweating, nausea, the feeling of unreality, numbness or tingling, hot and cold flashes, chest pain, the fear of going crazy or losing control, and the fear of dying. Given the title of my presentation, at some point I was going to talk about social anxiety. I would like to talk about social anxiety and how it might present, the assessment, and the treatment of social anxiety. Now, social anxiety disorder, or SAD, previously social phobia, is a disorder defined by fear of negative evaluation and is one of the most common disorders in Western society. The time of onset for SAD is about 20 years old, as 80% of the cases state the onset of SAD is age 20. Later onset is a rare occurrence. I would like to discuss the DSM-5 criteria for social anxiety disorder. But first, what is the DSM? Well, the DSM stands for Diagnostic and Statistical Manual. The DSM is used by various mental health professionals to diagnose psychiatric illnesses. There has been various additions to the DSM based on new research. The most recent one came out in 2013, known as the DSM-5. If you take a look at the picture below, you will notice the DSM-5 criteria for social anxiety disorder. Please note that there are various lettering to all the different categories or criteria. A marked and persistent fear of one or more social or performance situations in which the person is exposed to unfamiliar people or to possible scrutiny by others. The individual fears that he or she will act in a way or show anxiety symptoms that will be humiliating or embarrassing. Note that this may be different in children. There must be evidence of the capacity for age-appropriate social relationships with familiar people, and the anxiety must occur in peer settings, not just in interactions with adults. Next, B. Exposure to the feared social situation almost instantly provokes anxiety, which may take the form of a situational bound, predisposed panic attack. In children, the anxiety may be expressed by crying, tantrums, freezing, or shrinking from social situations with unfamiliar people. C. The person recognizes that fear is an excessive or unreasonable. In children, this fear may be absent. D. The fear, social, and performance situations are often avoided or else are endured with intense anxiety or distress. E. The avoidance, anxious anticipation, or distress in the feared social or performance situation interferes significantly with a person's normal routine. There is clear distress through daily activities. F. In individuals under the age of 18, the duration must last at least 6 months. G. The fear or avoidance is not due to the direct psychological effects of a substance, such as a drug or a medication, or a general medical condition. It is not better accounted for the symptoms that a person is experiencing. For example, panic disorder with or without agoraphobia, separation anxiety disorder, body dysmorphic disorder. H. If a general medical condition or another mental health disorder is present, the fear in criteria A is unrelated to it. For example, the fear is not stuttering, trembling in Parkinson's disease, or exhibiting abnormal eating behavior in anorexia nervosa or bulimia nervosa. I would like you to watch a short clip on social anxiety disorder. Please press play on the video, or if you're having problems accessing the video on this presentation, feel free to copy and paste the link below into your search browser. Thank you for watching that short video on social anxiety disorder. It has been proposed that people with social anxiety tend to focus on negative emotions during social events, and they tend to repetitively retrieve and ponder this information after the event. About 80% of the patients with social anxiety disorder will develop additional psychiatric disorders, notably depression, other anxieties, and drug-related disorders. Continuing with social anxiety disorder, social phobia, or social anxiety disorder, is the most common type of anxiety disorder and the third most common mental disorder in the population. In order to develop a social phobia, a person must be biologically and psychologically vulnerable to anxious apprehension. Social anxiety disorder has been found to be more common with females than in males. Behavioral inhibition in children has been linked to social anxiety at an older age. Moving on to assessment of social anxiety disorder. Now, anxiety and social anxiety can be assessed in various ways. Some examples of assessment may be behavioral assessment tools, interviewer-rated scales, and self-report scales. Social anxiety, cognition, and treatment. Contemporary theories of social anxiety and social phobia emphasize the role of cognitive process and the focus of attention for the maintenance of the disorder. Effective treatment changes a person's image of self in a more positive way. People who undergo exposure therapy reported that they had a decrease in negative thoughts towards themselves, therefore a decrease in social anxiety. There are various types of treatments for social anxiety disorder. Below are a list of different kinds of treatments according to Barlow 2011. Thought listening is the first treatment. Assess the focus of attention or balance of thoughts. Self-monitoring forums is the second one. Now, Barlow 2011 states that daily logs, journaling provides important feedback that should be incorporated into psychosocial treatment. The third is psychological treatments. This may include cognitive behavioral therapy, exposure therapy, and some social skills training. The last one Barlow includes is pharmaceutical treatments. So, for example, medication. There's different kinds of medication somebody could take for social anxiety disorder. Some were described in that video we played earlier. But here's a list of some of the other medications that might be helpful for people with social anxiety disorder. I wanted to discuss the stigma around anxiety and social anxiety disorder. There is a great stigma in society against people with mental health problems. This stigma may cause many implications that may make the mental health concern worse. People with anxiety face this stigma every day and often do not seek help from a professional. Empathy and the relationship between the client and the counselor play a crucial role in treatment. Caring and compassion are fundamental to human health care and are consequently emphasized across healthcare specializations. While creating and maintaining a professional relationship with a client, the counselor must maintain boundaries and hold their professional ethics within that relationship building. The vast majority of patients with SAD do not seek medical attention because they do not perceive their condition as a psychiatric or emotional disorder. Stigma is very important to bring up when talking about mental health. If we do not talk about stigma, the stigma will not go away. Did you know that World Mental Health Day is October 10th? Thank you for watching my presentation on emotion and social cognition, understanding anxiety and social anxiety disorder. I wanted to leave you off with a quote by healthyplace.com. My anxiety is silent. You wouldn't even notice a change on the outside, but I'm honestly so stressed I can't even manage simple tasks. People call me lazy, when in reality, I'm just overwhelmed.